Parkinson's disease is a progressive disorder. We have very good treatments and therapeutic treatment for the first few years, but it's quite a long journey. You know, it starts in many cases in a young age, and the life expectancy is pretty much the one of a normal person. So if you get Parkinson at the age of 30 or 40, you may have to live with that for 30, 40 years.
Well, the core symptom is that patients are getting slower. So, for example, when they move their hand, they can't do it as fast as they've done it before. They can't write in the way they've done it before. And a very, very simple symptom is that they start shaking. Not all of them have all symptoms, but one of the core symptoms many other people have is that they're getting stiff. So there's something we call rigidity. Parkinson's disease is still diagnosed by physicians. And the core diagnosis is just looking at the mobility and movement. And when movement is rather slowed and there are additional symptoms like resting tremor or stiffness, we can make the diagnosis on a clinic basis.
The treatments that we have are mainly replacement therapies, so that allow us to replace the one substance which is missing in the brain of people with Parkinson, which is called dopamine. Unfortunately, this therapy is efficacious and can give good therapeutic management only for the first few years. That's why we have been seeking alternatives, and the discovery that you could modulate the brain activity by inserting an electrode into the brain, targeting nuclei, regions of the brain that we know are supposed to be, in a normal person, modulated by this substance that we call dopamine.
Deep brain stimulation is a method to treat disorders of the brain that are associated with abnormal neural activity in the brain. So disorders such as Parkinson's disease or essential tremor or dystonia, they are associated with abnormal neuronal functioning in networks, in large networks of the brain. And deep brain stimulation is trying to correct the abnormal activity within these networks and thereby alleviating the symptoms of the disease. So it's a symptomatic treatment, but it's also going really to the heart of the disorder, which is abnormal brain function, trying to correct this abnormal brain function. Typically, deep brain stimulation is not a cure of a disorder, but it's a very good symptom relief that the patient can expect. For Parkinson's disease, this can mean that a patient can have a more stable treatment response rather than fluctuating between so-called on and off states where the patient is mobile and then being frozen immobile due to the fact that medication is not providing any continuous relief of symptoms anymore. DBS, in contrast, is always on, and it's providing very stable and continuous improvement of symptoms, so that's one of the advantages. Many patients have excellent medication responses, but they are not stable over 24 hours anymore. So they have a chance of having quite a substantial functional recovery when they have 24 hours on an optimal symptom control.